Right. So, in today's session, I'm going to explain you about what are the different features will be there. So, when we are developing any healthcare application, this is in regard to the product development of healthcare, especially because whenever we are developing any solutions for the healthcare organization, there are different products normally we do. Right? So, we do develop projects relating to the solutions relating to patient management. We provide solutions relating to billing, healthcare claims, and all that. At the same time, care management, case management, benefit enrollment, all that. In this regard, so whenever we, being a healthcare professional, whenever we are working on the healthcare system, whether it can be a business analyst role, or it can be a development role, or the QA teams, all that. It's always important for us to understand about what are the different features we have to develop. This is essentially required for the people who are into the healthcare roles, because we may be in the technical side or we may be in the functional side. It is always important for us to know about what are the different features which are involved in it. So as far as the involvement of that features itself is concerned, what are the different functionalities we need to be developed in this regard is all something which we must be knowing. So the first one, when it comes to the features and all, there are some list of features I was mentioning here. I'm mentioning here. Right? So there can be many, but there are some new general features which I'm mentioning. Right. So as follows: the first one about the practice management, followed by scheduling, billing, at the same time financial reporting, EHRs, patient engagement. These are the different features as far as the healthcare is concerned we want to develop. But when it comes to the practice management itself is concerned, because whenever we are working on practice management, it's always important for us to understand about the scheduling part, because whatever the scheduling are we going to do, scheduling of appointments, I can say, like, for example, if there is any kind of schedule you want to make it for appointment, right? So you need to have any kind of appointments with the doctors, right? So appointments and all, appointment reminders. At the same time, scheduling the snapshots, followed by the kind of recurring appointments if any uh, patient wants to be taken from the doctor, right? So all that. At the same time, waitlist management. Followed by this, one of the important aspect we will be focusing more on the appointments is all about insurance eligibility verification. Because an individual has came for the treatment to the hospital or a healthcare organization or a unit, healthcare provider. Normally, we call them as providers. There must be an insurance eligibility verification has to be done first. So based on the eligibility verification, they will come to know whether the person is having a valid health insurance or not, and what are the benefits this individual can use of, right? So based on that, whatever the suggestions and all, everything will be given. In this regard, it's always important. Do remember, as far as the practice management itself is concerned, these are all the things which are involved in it. Scheduling and all, everything is one thing. Next, after that, when it comes to the billing part, so there are different billing will be done. Because, for example, if you want to manage claims, or else if there is any kind of clearing houses, because whenever there is any claim processing, normally we do. So between these two, claim processing and all, there is a clearing house which will make sure whether the document, whatever the medical billing document was created, claim document was created, submission document is properly mentioned, all the code numbers and all, everything comes under that. This is what generally we call it as clearing houses, all that. At the same time, whatever the payments made by the patients, right? So all these things comes under the billing point of view. This is also one of the key and important element whenever we are working on the practice management. We have to be good with. So the first one, as I stated, so as far as the processes itself is concerned in that, scheduling is the one thing. Second, billing is one of the key and important element. The next about the revenue lifecycle management, because when it comes to the revenue from the organization perspective, whatever the revenue you want to generate, right? So revenue generating and how this revenue is being sharing across different departments and all, right? So this is all comes under the revenue cycle management. So next, reportings and all, right? So we have to create reports and all, right? So reporting, analytics and all, everything were required. Either it can be a separate software now, and then we are having for billing analytics software. Normally we will be having nowadays. So whatever the billing analytical softwares and all, we are creating a separate software even for billing analytics and all. At the same time, any processing we do, for example, any billing was made through credit cards and all that, even credit card processings and all, everything comes under that as well, right? So because card payments and all, everything. So this is all comes under the practice management part. Next, when it comes to the scheduling part and all, everything, even patient self-scheduling, because a patient wants to take an appointment from the doctor and all, everything, self-scheduling can be done. So this is one of the functionality you need to develop under the particular feature, followed by patient room tracking, or either it can be EHR dashboards, right? So because if there is any kind of electronic health records you are maintaining, so whatever the dashboards are required to have a better visibility, this is all comes under the EHR dashboard part. Next one about the billing part. So wherein either it can be A&R control centers, or it can be central billing offices, or it can be clearing houses or claim centers. At the same time, whatever the kind of claim inspection or review you want to be made. Followed by this, if there is any kind of coding, this is where generally medical coding come into picture, because there will be a billing team, biller team, medical coding billing team will be there. So who will be doing the billing, right? So what if medical coding, billing and all, everything will be done in this regard. Along with this, there are some data conversion we want to make, especially in the billing part itself is concerned, followed by eligibility verifications. At the same time, whatever the electronic claims, right? So all these things are comes under this category. This is all something which is essentially required as far as the billing itself is concerned. Being into healthcare professional, either we may be a business analyst or a development team, or else it can be it can be QRLs and all, everything is what something we must be good with. So billing is also one of the key and important element one must be good with. So these are the major, right? So these are the primary areas, whatever the areas I'm talking about, these are the primary areas will be there. One is about practice management, scheduling, billing and all. Next is financial reporting. When it comes to the financial reporting, there are different advanced reporting analytics we have to prepare for a better visibility. This is also one of the feature and functionality one has to be created. One more important task about the electronic health records, because whatever the records we maintain in the field of healthcare, everything in electronic format. So creating some electronic health records, at the same time patient cards, right? So customizing templates, followed by the kind of mobile application you want to create, right? So for mobile applications, or else if you want to send any messaging to the patients, right? So regarding the reminders and all, patient messaging system or patient rooming. At the same time, we have to create some dashboard even for physicians as well, because whatever the visits patient visits a physician has addressed, and followed by this whatever the medication they have given, right? So everything can be updated under the physician dashboard, etc. All that. So followed by this, if there is any kind of telemedicine facility you are going to provide. At the same time, e-prescribing, right? So all these things are comes under the EHR part. Next one about the patient engagement, right? So how are we engaging with the patients? Either it can be appointment reminders, as I mentioned in the beginning. So this will be a part of it. At the same time, care and case management, because whatever the quality of care are we going to provide to the patients, followed by the case management, case to case, whatever the care services are we going to provide, right? So hospice care, right? So in-person care, right? So these are all comes under the patient engagement part. At the same time, in addition to that, even benefit enrollments, how the benefit enrollments has to be made, right? So healthcare benefit enrollments and all. At the same time, if there is any kind of provider and payer and provide integrations are we having. So all these things are comes under the different features whenever we are developing a healthcare application is what something being into the roles, right? Irrespective of the kind of roles are we belongs to, these are all something which is essentially required when we are working on the healthcare side. So this is all about this video. If you have any questions, if you have any queries, please reach out to the contact details which will be posted in below to this video. Thank you.